Welcome to Bad to the Bones, the podcast where we discuss everything related to orthopedics, joint health, and living an active lifestyle. Welcome back to Bad to the Bones. I'm your host, Debbie Rody. Today's episode is a little different. We're stepping beyond just conditions and treatments and really diving into the art behind the practice of medicine, specifically spine care. Because when it comes to spine surgery, it's not just about performing a procedure. It's about judgment, precision, experience, and decision-making at the highest level. Joining me today is Dr. Rahul Shah, board-certified spine surgeon, fellowship-trained in spine surgery. He's highly regarded spine surgeon here at Premier Orthopedic Associates in Southern New Jersey, known for his advanced techniques, clinical expertise, and thoughtful approach to patient care. Welcome to the show, Dr. Shah.
Well, thank you for having me.
We're really excited to talk about just the art and the craft of what you do and share with our listeners, the differentiator between what Premier offers in spine surgery. So when people think about spine surgery, they often focus on the procedure itself, but there's clearly a deeper level to it. How would you describe what goes into the craft of being a spine surgeon?
So surgery is a very personal, manual experience. Everybody has to go through it as they go through their journey of their own discomfort. And it's a very difficult time and place for people to go through because they have pain that's in one spot and then it travels to other areas. So there's a journey of trying to figure out where the discomfort is coming from. And then once that journey has been achieved, then they sometimes don't make as much progress, and sometimes surgical solutions are the best solution to help them improve their quality of life. Mm-hmm. But at that point, it sometimes gets reduced to a set of data. This is what my x-ray show, this is what my MRI shows. But nobody in the world is just defined by those individual pictures in time.
Right.
We all have a lifestyle. We all have things that we want to do.
Mm-hmm.
And so when it comes to spine surgery, it isn't about robotics. It isn't about lasers. It isn't about my MRI scan. Those are all characteristics.
Yeah.
The process is really a personal one that has to be between the person that's having the discomfort, their family who's concerned about them, their friends who want the best for them, and the surgeon who also wants the best for them.
Yeah.
And to make sure that that understanding is achieved. But when you can't see a problem and you have to rely on stuff, sometimes that problem isn't defined by the lifestyle, it's defined by these images or these points in time. And so if you were to talk about the craft of spine surgery, the craft and the art is really to meld the story that's being told by the constant day-to-day ache that somebody has, mm-hmm. the constant day-to-day challenges that people have in accomplishing their goals, and then these tests that help to show us that maybe the problem is here.
Right.
And then putting together how all of this fits together and how a solution might help to stop that or potentially even reverse that.
Yeah. And that can sometimes, I'm sure, be a challenging story to bring to life for a patient. So, well, I know there's this concept of a scholar surgeon archetype. Can you share your thoughts on that? Not just as a surgeon, but as a thought leader and author of definitive surgical text?
So it all still comes back down to that same essential problem of I can't see the problem. I know what I feel.
Yeah.
And I need to make sure that whatever I do will actually help the problem I'm feeling.
Right.
Are you clearly solving an issue that is clearly a problem, or are you solving a sideshow that won't help my problem? And the way many people go about that is they want to see a surgeon that will just fix me.
Right.
But really someone that's thoughtful is probably the best fit in my view. I've been very fortunate to go through a very extensive lineage of thoughtful surgeons and scholars ahead of me that have written all the definitive texts for all of the standard approaches to the spine, whether it be for the neck, the low back, or deformity and things of that nature. Mm-hmm. We have certainly added to that same vein, and we've certainly added in that by publishing in our own right and making sure that we are talking to other surgeons and other thought leaders across the world to make sure that the understanding of that elusive problem that someone faces but can't see is in fact elucidated and made clear by the different types of maneuvers or tests that we do.
Yeah.
Put another way, we're trying to make sure that that MRI scan that may show a problem fits with an X-ray when somebody's sitting or standing or bending.
Mm-hmm.
So we know how that image that was taken when the person was laying down
Yeah.
actually interacts with the world. Then we see how things that they say didn't work may have worked slightly, and how that slight improvement, let's say it was an injection that gave them relief for a couple of weeks,
Mm-hmm.
helps us to understand how their problem is adapting or behaving
Yeah.
with the difference.
And I imagine that little bit of movement that you have in the progress of treatment, that changes the picture again, right?
Exactly.
Yeah.
And that helps us to build confidence because we then use that experience.
Mm-hmm.
You know, I've been very fortunate. We've been taking care of patients in the South Jersey area for some time. Our lineage at Premier has been starting from the ground up and really building up a multi-specialty
Yeah.
clinic that addresses all forms of musculoskeletal issues from the head all the way down to the toes. And there's been a real commitment to the art and the real precision of taking care of patients in the South Jersey area. Yes, we have people that come from all over the world,
Yeah.
but we really have been able to cultivate this by really focusing in on identifying how these pathologies or these areas that affect all over the world, patients all over the world, how it affects our patients in South Jersey,
Mm-hmm.
and how they get results that are as good or better than anywhere in the country.
So with your experience and that just being said, how would you say that this evolution of your experience has been refined or become more intuitive about how you practice?
You know, it is exactly that. It's the subtleties that make the difference, not the major things.
Yeah.
And, you know, we have been so fortunate to go through so many iterations.
Yeah.
When we came here, we didn't have long films. We didn't have scoliosis x-rays of how people stood, or we didn't have robotic surgery. We didn't
Yeah.
have advanced minimally invasive surgery. All the buzzwords that you see people talk about. We've been able to incorporate all those individual tools. And what we've noticed is because in South Jersey, we're in a little bit more of a rural area.
Yeah.
We have people that live more difficult lives as farmers, as technicians, as
Yeah,
blue-collar
absolutely.
workers. And so they're really loading their spine in a manner that's slightly different
Mhm.
than someone that may not be doing those same heavy tasks. And so we've been able to see how our patients respond to standard treatments,
Yeah.
how to make those treatments better, and how we really meet people on their journey towards achieving their life as compared to the life that they're afflicted by. Because when you live a hard life, sometimes you may have difficulties with areas that get tweaked, or areas that become stiff,
Yeah.
or areas that become more painful because they've just been worked a fair bit. And so what we've done, to answer your question, is we've come up with our own unique brand of being able to meld in by understanding people's problems,
Yeah.
to blend in like sugar and milk, right? We really try to add sweetness so that they are able to go through the journey of recovering through spine surgery in an effective manner, but are able to assume the types of quality of life or day-to-day functions that they want to achieve, but have not been able to
Yeah.
because they've been limited.
Well, spine conditions can be complex. That's probably a given, right? And not every patient requires surgery. So how do you approach the decision-making process of determining who would be a surgical candidate and other treatments that you really believe can alter their life for the better?
I think it's an excellent question. And I think that the two fundamental sort of pillars to answering that question are a bit of restraint and a bit of gratitude.
Yeah.
Let me start with gratitude first. I'm super grateful that we have a full team behind me that work to ensure that we're not only clarifying the problem, but we're always testing which solution is the best fit.
Yeah.
Surgery is in the continuum of solutions, but the solutions may start from altering someone's muscular structure, maybe improving some muscles or targeting on other areas to grow or hypertrophy.
Yeah.
And we have an excellent team of therapists in the South Jersey area as well as at Premier itself.
Right.
In addition, we have an excellent set of primary care providers who are optimizing people's other types of hormones, if their thyroid is off, or other types of electrolytes or other types of areas that can potentially help them. If it becomes something that is not necessarily responding to these because the problem is more focal, and where a nerve is being jammed up or a deformity is progressing, sometimes physical therapy may be not enough, and injection-based treatment and then going back to physical therapy is something.
Right.
And so all of these options are always being evaluated at the same time surgery is, because we're looking for the best fit, not the only fit.
Yeah.
And with enough patience and enough understanding and commitment to understanding how the problem affects somebody, the solution becomes pretty clear pretty quickly. And it's in identifying the essence of the problem and agreeing about that, and identifying the essence of the constraints that the problem causes people. I'm limited by this, I'm limited by that. That the solutions become obvious, and then it's a truly shared decision-making about what the best choice might be. So to answer your question in short, it's a combination of gratitude for all the people around me that are helping to make sure that the person doesn't need surgery.
That collaborative approach.
And then there's the restraint of only doing surgery when we know we have a clear issue that we have had experience. And luckily, we've had over 20 years of experience in this community being able to deliver highest quality spine care. And so we're able to have very good judgment about when to use the restraint and when to say the restraint isn't enough.
Right.
And that's something that, unfortunately, there's no shortcut but time to get to.
Well, and so when you have exercised all of these other, options, but the candidate, the patient is not responding, and now they are a candidate for surgery, how do you, there's obviously very high precision, high level of precision in what you do in surgery. How do you approach a case? Is there anything specific or general about the way you approach each case to make sure you check all the boxes for the best outcome?
Yeah, so there's a lot of subtleties that you talk about, and let me sort of deep dive into some of them. One of them is the stuff that we do before surgery. We try our very best to get patients ready for surgery, but sometimes if you're in pain, it's hard to get conditioned and get ready for where things are. So we do a very good job to try and understand where problems are coming from. And then what we really try to do is try to make sure that all the testing that we can do that's reasonable is done, because we're not looking for just the problem, but we're also looking to actively falsify that it's not another problem that's similar.
Yeah.
Somebody comes in with shoulder pain and we say, oh, it's from your neck. And of course, there's a problem in the neck. So we say, look, the problem's in the neck.
Right.
We're also checking the shoulder.
Yeah.
We're also maybe not only just getting an MRI, but we might be getting some nerve tests to make sure that there's no other nerve problems that are going on. And maybe we are also getting a CAT scan to see if there's any bony problems that the MRI didn't pick up. The rationale here isn't to see if we're right or if we're wrong, but it's actively check to make sure that we're identifying it so that it is no question that there's nothing else that's going on. So that's the first part.
Yeah.
The second part, in terms of the actual portion of surgery, is I'm incredibly blessed to have a dedicated team behind me where we all work in an almost seamless, simulated fashion where there's almost no words exchanged. There is a dance and an art where we're all working, where I move left, my physician assistant moves right, and we're working together so that we are cross-checking one another such that our individual actions are summing together to form a custom fit.
I love that.
That's being checked on multiple areas.
Yeah. So can you walk us through a case that might have seemed impossible at the onset, where you had to get really innovative and make critical decisions to really save the patient's mobility? Is there anything that stands out for you?
There's so many sort of subtleties that can
Yeah,
be
I'm sure.
applied to that. But I'll tell you, just a patient I saw today in the office today. This was a gentleman that we had done surgery on maybe 10 years ago, and then he had another injury at work. He had fallen and he had disrupted another area, and we had seen that he had basically needs some additional surgery, and his posture was starting to get affected. And so we devised a minimally invasive solution where we spared a lot of different muscular attachments
Mhm.
because we had worked with the designing of the implants to get the correct custom fit solution.
Okay.
So he's about 6 weeks out of surgery, and when I saw him, he came in with a cane and was not able to sit or stand for more than 5 or 10 minutes at a time before in significant pain.
Yeah.
Today, 6 weeks after surgery, and mind you, this gentleman has had extensive surgery. Number one, it doesn't look like he had surgery. Number two, when he got out of the chair, I couldn't tell that he had surgery. And number three, he did a deep squat unassisted and got up.
Oh, that's awesome.
And number four, he's 40 pounds overweight. So what it tells
Yeah.
you is not that someone is defined by their weight. It's not that it's defined by their deformity. It's not that they're defined by their nerve compression. It tells you that our goal is to satisfy each of these constraints in a manner that's reproducible and repeatable.
Yeah.
But it only comes from a real attention to the underlying subtleties of the craft so that we're able to do this over time.
So you've treated a wide variety of patients in your career with different spine conditions. Would you say there's anything in particular that has shaped your ability to recognize certain patterns, or that have just given you some additional insight in tailoring treatment plans?
Yeah, I think that that's an excellent question, and I think that it's hard to answer in a way that's universally understood. So let me tell you some simple things that we've done that really make a significant difference. I have learned to understand that when somebody goes from a seated to a standing position, the effort that's required in that roughly 2-3 milliseconds, maybe 4 milliseconds, can be very instructive of how their entire day is going to go, because those subtle movements of turning and twisting are the areas where the back is getting significantly stressed, and how someone handles that allows you to understand where things are. And paying attention to that subtlety allows us to know if our treatments are working quicker because we're paying attention to a very specific area. Anybody that's had significant back discomfort or neck discomfort knows that getting out of bed is murder. Getting in and out of a car is murder.
Yeah.
Everything is a chore. And they also know that when that's been freed up for them, how easy and how seamless that is.
Yeah.
So the most effective way that I can answer that question about what I've learned, it's really been those subtle twists that have really made the difference. And those twists cascade, meaning when somebody has a tough time in the morning getting up, the rest of the day doesn't get easier. It tends to
sets the
compound.
tone.
And so we've been able to know and optimize those areas. And so we make judgments about what fits somebody better by looking at that, not whether or not just their pathology on an X-ray or an MRI was addressed.
So are there subtle things that you pick up on during your evaluation that maybe a less experienced clinician or surgeon might not see?
I've definitely learned a fair bit throughout my career, and there's definitely areas of the spine that I pay attention to.
Obviously, without giving out your secrets, your total craft.
No, and the truth is all of us that do spine surgery, we're incredibly fortunate to have the training that we have, and we're incredibly fortunate to be able to serve the patients we do.
Yeah.
I don't know of any spine surgeon that does it for anything else than to help their patients. So in my view, the more important question is what is the journey that I've gone through that's allowed me to understand some of these, and what makes that unique sort of approach helpful. And I think that some of the areas that I've been able to pay attention to more were the areas that were oftentimes when I was training were said, oh, that's not that important.
Right.
And it's assigning importance to the areas that weren't that important. For example, we've been working on some things right now where we have patients work on an interactive diagram to show exactly where the discomfort is, where most forms that you're given out that you have to fill out, I have burning pain or stabbing pain or deep ache pain, that doesn't fit the description that someone has.
Yeah.
Anybody that's had back discomfort will say, well, you know what? It was like a lightning pain, or you know what? There was a cold fire pain. Well, I don't know what a cold fire is,
Yeah.
but I know that that's what they experience because I've heard that multiple times.
Okay.
So it's better to then be super clear about the location of the discomfort and understand the movement of that discomfort, because then you can understand how to interact with that discomfort.
Yeah.
And it's understanding those subtleties that have allowed me to be able to understand how the pain saturates at the top and at the bottom, and how certain levels of pain or certain levels of disability or certain levels of discomfort that correlate with someone, of how they grimace, or how they get up and out of a chair, or how they have a difficulty turning to the right side or the left side. Those subtleties all are now picked up in a manner that's almost impossible to describe and almost impossible to quantify.
Yeah.
But we're working on doing that to be able to make that so that we can then improve on those areas.
Let's move on to, I'd like to have some conversation on what you think makes a surgeon sought after. I mean, you are a world-class spine surgeon, sought after from people around the world who have come to see you. Patients today are more informed than ever. You know, we have a lot of access to information. What do you feel is your differentiator that really contributes to the outcomes you deliver your patients?
I think outcomes are clearly what everybody looks for, and
Yeah.
not everybody has the ability to compare outcomes because nobody's seeing all the outcomes of every person.
Yeah.
So then you rely on message boards and things of that nature to understand who's got a reputation, et cetera, or your friends and family.
Yeah.
I think it's a fine way to start. But the question that you're asking is, what do I think differentiates me from where things are? And just like a leopard knows their spots, I think my spots that allow me to deliver what I'm able to deliver is based on a couple of key core principles. One is curiosity. I'm genuinely curious about the patients that I have and the problems that they have and what makes it worse or what makes it difficult.
Yeah.
Anybody that's listened to someone complain can find it overwhelming after a while because you're hearing the same thing again and again. And in my view, because I'm able to often redefine the problem in a manner that other people have not defined the problem, the curiosity naturally flows.
Yeah.
And that allows me to identify the constraints of someone's individual problems better. That then allows me to be more thoughtful about the solutions that we propose.
Yeah.
And then when you take all of that and then you marry that with our incredible pedigree and lineage and the incredible support staff we have around us, the solutions that come about are almost mind-boggling because we have so many patients that do so much better. And our goal, of course, is to serve and support them.
Right.
And we're able to do that on a consistent manner.
So when peers refer patients to you, what do you think they trust most about delivering them into your care?
I think that there's a clear commitment to quality that my team and I adhere to, and I think that that's accepted.
Yeah.
I think the other thing that we always do is we try to be as straightforward as we can with our patients to show them where the mismatches are and how we're looking to get congruence across all of the underpinnings of what the patient might be experiencing so that it all makes sense for them.
Yeah.
And I think that those are some of the areas that are more, that we deliver more consistently and more regularly that people tend to value.
Yeah.
Of course, the results speak for themselves.
Sure.
And then outside of those individual areas, I think that we are incredibly kind to our patients, which I think is when you're hurting,
You want
sometimes you're
some
not.
compassion.
Yeah, you want somebody to be kind to you, and
Yeah.
sometimes as simple as that may sound, sometimes you feel as though you're potentially being brushed off.
Yeah.
And I get it. We're all human. We all have difficult days.
Yeah.
But I think that we have been able to do that more consistently than others, and I think that allows us to continue to stay engaged in helping our patients.
Well, in your field of spine surgery, how do you refine your skills, if that's even a way to put it? I mean, does the technique change over the years? Is there someone out there that says, you know what, I'm going to try something different on this patient while I'm doing surgery and see how it goes?
Yeah.
How does that happen?
Yeah, in some ways it does. I mean, that's how innovation occurs. It's not as willy-nilly as you say.
Yeah.
It's in a more controlled environment, and it's all done within the parameters that have been. See, if you say, "Oh, I'm going to try this" or "I'm going to try that," what that seems like is this person's experimenting on me.
Yeah.
In reality, we have a huge body of knowledge that we've assembled from my time at all the prestigious academic institutions that we've been at, and all the lectures that we've taught, and all the surgeons that we've taught, and all the battle testing that we've done.
Yeah.
It allows us to have an idea of what the constraints are.
Yeah.
But within those constraints, there may be some subtleties that we have to do because everybody's body's slightly different.
Yeah.
And at the most technical level, the instruments are not always designed for an individual person. They're designed for a series of people or a population of people. How to customize that individual instrument to that individual patient is really where the judgment comes into play. And you can call that experimenting, but that's really where you're refining. And that's why they call it the practice of medicine, because it's those individual movements at those individual nooks or those individual crannies that allow you to ensure that works best in our hands. And so when we get done with a surgery, there is always a after brief where we talked about the areas that were challenging, the areas that worked well, the areas that did not have as easy of access to go through, so that we can then continue to identify the areas that outperform over time.
For someone dealing with spine issue or a condition, what would you suggest they look for when choosing a spine specialist?
I think a lot of the categories we've already touched on, and I think that if you are looking for a spine surgeon, I think you want to make sure that they are listening to what you are saying and that you feel heard and understood.
Yeah.
It in some ways is fantastic when you can describe half of the statement and the surgeon can finish the rest of the statement for you.
Yeah.
Where they can say, I know you're having this, but I think you might also be having this, and this might also be part of it. That then leads to more confidence internally that you're talking about the correct problem.
Yeah.
Oftentimes, technical surgery that's done technically on the incorrect problem will not result in the correct results.
Yeah.
So we want to make sure that is something that you have, and then you want to identify someone that has had experience within the field and has had a proven track record of results over however much time that they've done, and that over time their results are continuing to speak for themselves. So I think those are the things that if I were to advise my brother or my sister to look into, those would be the points of what I would say to look for in terms of selecting a person to help you through your journey.
I like that. That's good. Well, Dr. Shah, thank you so much for your time today. This has been a very insightful conversation. It really highlights a lot of what spine surgery is about, not just surgery itself, but technique and the craft and, everything that you bring from your expertise to judgment and precision. So we appreciate your commitment to excellence. Thanks for being here.
Thanks for having me. It was fun. Thank you.
Thank you so much for joining us on another episode of Bad to the Bones. If you or someone you know might be struggling with back pain, call or text us at 856-690-1616 or visit poasnj.com. And as always, keep those bones and joints moving.